Hey, it's Dr. Miller. First of all, congratulations. I know you've been waiting for some time to have this reveal and have this done. So you should be, first of all, real happy with yourself and congratulate yourself for getting this done. Naturally, I'm going to go over all of the post-operative instructions with you personally, but this way I can go in a little bit more detail while you're waiting for me just a little bit. The cast just came off, and so as good as it looks, it's still swollen. Okay, I want to reassure you that, and everyone is. I don't even have to see you to tell you that, but you'll be swollen. And the swelling actually may increase over the course of the next 2 or 3 days because the cast came off. And because the cast came off, the swelling may increase a little bit, but then it's going to rapidly go down. Over the course of the next 3 weeks to 3 months, almost all of the swelling will be gone. But that's just the first phase of the healing process, which is swelling. The other phase of the healing process is skin contraction. And skin contraction can take almost a full year, sometimes 18 months, while shrink wrap can occur almost immediately. You know how you shrink wrap something? You apply some plastic around it and you heat it up with a hair blower, it shrinks immediately. The skin doesn't do that. The skin can take almost 18 months for it to really contract. And so while you'll still see a great result within a week, within 2 weeks, you're not going to see the real great definition that you expect until such time as the skin can contract. So that's what we're waiting for at this time, and what the timeline is for the nose and the swelling and the healing. During that time, as you glide your fingers up and down your nose, you may feel little bumps and lumps. And if you feel that, that's simply sutures that are dissolving, or maybe little pieces of tissue that are swollen that are going to settle down. So don't worry about that. If you see it, if you don't see it, but you feel it, it's going to go away. Now, what if you see something? The way bone heals, bones form a callus. And so they actually form a little callus like this, and then eventually the callus goes back down again. So often right after surgery, some people, or even weeks or months later, they notice a little bump in and around this region over here. And that, again, it sort of appears, and then over several weeks or months, it goes away. So don't be surprised if you see that either. If you have incisions on the outside over here, I'll take a look at it. At worst, they're red, and then they often turn bright pink, and then light pink, and then eventually they just fade away. We sell a really great skincare product out in the lobby that you can use on the incision line. Alternatively, you can just pick up anything with silicone in it at your local drugstore. That works perfectly as well. If you have any facial bruising, unfortunately that's a consequence. I hope you don't, but if you do, it will be gone within 2 or 3 weeks or so. Continue using the Arnica if you have some bruising, and if it's really, really bad, it's unlikely, but if it's really bad, we can do an intervention that gets rid of some of that. The nose, you can start sniffing back today, okay? You can be a little bit more aggressive. You can even start blowing your nose gently. Blow your nose just to clear it. If you've been using the saline nasal spray on the inside of your nose to sort of keep things moisturized, by all means, you can continue doing that. If you haven't been doing it, then you don't have to. But you may want to start because you may find that that it's very comfortable. You can stop using the peroxide on the incision line, and you can stop putting the ointment on the incision line. Keep the ointment though, because if you feel that it's getting a little irritated, particularly in the front over here, weeks from now, you can apply that ointment for another couple of days, and you'll see that irritation or redness goes away. You can also stop your antibiotics. Almost everyone can. If you're an exception, I'll let you know. Don't be surprised if you have some difficulty breathing through your nose. That's totally normal, as you would expect. That's going to go away within a couple of weeks. And your sense of smell ultimately may actually improve. But don't be surprised if in a couple of weeks you actually get a bad smell on your nose. What's happening is the sutures are dissolving. And when they dissolve, they sort of have a bad smell to them. It can go away simply by blowing your nose, maybe using that saline irrigation to get rid of it, or within a week or so, you're going to blow your nose, you're going to sniff back, and it'll be gone. It'll just be blown out your nose. You can return to your normal facial wash, moisturizer, makeup routine, vitamin supplements, vitamin regimens, shampoo, conditioner. You can go back to all of that. You no longer need to sleep with your head elevated. But if you do sleep flat, then it'll be swollen in the morning. But when you get up and walk around, the swelling will be gone within an hour or two. But if you can't stand sleeping on those 3 or 4 pillows, it's fine. You can start sleeping flat. I still don't want you to put too much pressure on the sides. So if you want to sleep on your cheek, that's okay. Just obviously not like that. At least for 2 or 3 more weeks. Okay, 2 more weeks. 2 more weeks is fine. And if you're wearing, I'm going to go over whether or not you can wear glasses. So pull out your glasses and have it ready for me so that I can feel them. And finally, the next question, or the last one, is how active can you be? What about working out? And to me, those are really 2 ends of the same spectrum. Working out and being active. And the answer is just use common sense, okay? If you're feeling pain, pressure, or headache, then whatever you're doing is too much. And it doesn't matter if you're walking down the sidewalk with a heavy bag or if you're on the treadmill. If you're feeling those, stop it. And even on an extreme, it can even occur 2 months later when you start a new exercise. My favorite story is about a woman who I operated on, and she was doing great. She was a friend of mine, so I saw her frequently. And then she brought her son in, and I looked at her nose, and I saw that it was a little swollen. And I asked her if she had done anything new lately, and she said, yeah, she started hot yoga where she was bending over, and the nose wasn't ready to handle that. So she had to stop that for several weeks, and then she could pick it up several weeks later. So again, use common sense. If it's causing pain, pressure, or headache when you exert yourself, don't do it. If you're not having those symptoms, then by all means, go back to work out. Go back with your regular activity. Believe it or not, 99.99% of my patients, this is all of these instructions are applicable to you. I'm going to go over anything that's different, and I'm going to give you your instruction sheet as well. If you have any questions, let me know. And again, congratulations.